So there's this new device that could test marijuana use within hours. Can you tell me about this device?
Yes, I'm very excited about it. It's called the Hound Labs Cannabis Breathalyzer, and it is our collect and send. It is the first cannabis breathalyzer to the market in the US that isolates recent use of cannabis in a person's breath.
And how is this a game changer when it comes to, employment?
Workplace drug testing has been an effective tool for risk mitigation and deterrence of workplace drug use. And there's really harmful effects of that. When cannabis legalization started, which is nearly 3 decades ago, it entered something new for us. And what that was is, how can you allow people to legally use cannabis, but then test them using traditional drug testing methods that are effective? They're very effective, but they don't isolate recent use. And so why it's a game changer is employers want to still be able to use this extraordinary tool that drug testing is, but not look back at use that happened 24, 48 hours ago, or even in some cases, weeks ago. And so it was very important to have a tool that allows someone to look at that very recent use that happened during the workday versus that past use that really falls into somebody's private time.
When it comes to, I know, with the alcohol breathalyzer, it tells you exactly the intoxication level. Does this breathalyzer, does it just test use, and is there some metric system to it?
Well, it's interesting. So every drug test has a cutoff level, and we made that determination through a very long series of R&D events and clinical studies. When you think about alcohol testing, it actually doesn't tell you if a person is impaired. It gives you a reading that's 0.08. And in all states except Utah, that's the per se legal limit, right? It doesn't tell you if the person's impaired. They have just determined that that level equals impairment. When you look at what the Department of Transportation does, they actually use evidentiary breath testing equipment, but they remove people from safety sensitive positions or performing safety sensitive job functions much before 0.08. They start taking action at a 0.02. What the cannabis breathalyzer does is it provides an objective measure with a sample that is collected the same from each person. And what it does is, if the screening test at the laboratory is above that limit, then it goes for a second confirmatory test. And the results of that confirmatory test, if it's at or above the detection level, means that that person was positive and that that use occurred contemporaneous to the workday in which they were tested.
And I know, has there been any employers or any organizations that have reached out to you guys that you've been starting to distribute to?
Yes, we are thrilled to say that we started shipping out. And so several hundred employers actually have our device in their hands. And we are shipping daily out to new employers who are looking for the solution and have been waiting for it.
Can you tell me some of the different fields or industries these employers are in?
Yeah, I mean, we really have seen employers across the board who are looking for a solution in different states across the country. We do see a prevalence of employers who have positions that they deem safety sensitive, really as some of our very first adopters to the market. But they fall in so many different categories. We see them in everything from retail to transportation, manufacturing, but there's interest in all industries, whether they're safety sensitive or not, because again, they've always tested for cannabis and they didn't want to lose the ability to do that. And so we've seen it across the board. And we continue to see people interested in different sectors of industry.
Perfect. All right. Um, Is there anything else you'd like to add that I didn't ask?
Um, well, I'm trying to think. I think it's I mean, I think you've covered the basics for us and what people are using. I think the most important piece really is that it is that isolation of recent use that really is what's been missing in the market. And I've been in this industry for 32 years. There are effective tools in the market for looking for many different drugs, but what has been missing is this isolation of recent use. And it's important when you look at employers, when you look at their DEI initiatives, when you look at their safety initiatives, when you look at their hiring initiatives, not to look at just how many people did I catch, which is sort of a traditional thought in workplace drug testing, but it really is how many jobs did I save? The goal should be when effectively implementing this new technology into a workplace drug testing program that you have zero positives because you've deterred the use at the workplace before it happened, and you'd adhere to the policy of no use during work while allowing people to make their individual and independent choices at home in their free time and not have a negative employment action taken against them because of that.
And again, before your company's device, it would only test usage within the periods of weeks, or it didn't. What was the tool before?
Well, workplace drug testing, I mean, you can test for blood and you can test for sweat tests, but those are rarely, if ever, used in workplace. They're tend to be in the criminal justice arena. So the most prevalent is urine, and urine can pick up cannabis use for weeks. Weeks. Hair testing isn't good for recent use because it takes about a week for the cannabis to show up in the hair. And so that's really not an effective tool. That's like a lifestyle tool. And then oral fluid detects about 72 hours, 48 to 72 hours. And so you could see that if you were to use on a Friday night at a concert and then show up for work on Monday morning and be tested, that could still show the use of that cannabis. And so our test really just looks at that several hours, and that really saves those jobs for employers and for employees.
Can you tell me what, I guess, compound or what mechanism is in the breathalyzer that is detecting marijuana use within hours?
Well, what we are looking for is THC, which is the psychoactive component. It's what gets you high, right? We are not looking for CBD, CBN, other compounds in cannabis. We're collecting a standard breath sample, and then we are testing that using really workplace testing technology that's been in place for a long time, immunoassay, and then LC confirmation. The technology for capturing that took a very long time to develop, and the procedures we've used to make sure that we're getting a consistent, defensible test that is the same for each individual are really part of and parcel to the technology we've developed and the patents we hold at Hound. Um, but really, I think what's important is we are isolating the use of THC. We're not looking at anything else. And we're looking for that parent metabolite. And as you look at some of the new drug testing laws, that's a very important distinction that we look for that parent drug, not those metabolites that linger in a person's system for a very long time.
Alrighty, perfect. Right. Is there anything else you'd like to add that I didn't ask?
I don't think so. Our system is available. We are willing to talk to employers about how to best look at how they could use this new system in their workplace, and we're anxious to see the reaction to the market from the market.
Alrighty, awesome. All right, thank you so much, Nina. I appreciate you doing this interview.